Hello, everyone. This is Dr. David Hudson doing your virtual online lecture for NUR 391 on oxygenation. So the first few PowerPoint slides on your stagnant slides are an anatomy and a physiology review of the respiratory system. I will not be covering those in lecture. Those are more for your benefit, so please make sure that you review the first few slides. So this first section here that we're going to talk about will be the function of the pulmonary system. This is in some way a review, but the terminology is extremely important for you to understand. So ventilation is the movement of air in and out of the lungs through the act of breathing. So this is the mechanics of breathing. We inhale, we exhale, that's ventilation. Respiration is the exchange of gases and oxygen and carbon dioxide during the mechanical ventilation component. Okay, so we can have ventilation and not have respiration, but we can't have respiration without ventilation. Okay, inhalation is when the chest expands and we move air in and it creates a negative pressure in the lungs. Exhalation is just the opposite. It's when the diaphragm and intercostal muscles relax, our chest decompresses, and our lungs decompress and they return to their normal size, and one could say they create a positive pressure. Respiratory rate is how fast we breathe, and respiratory depth is how much our lungs expand and contract to take in and remove air. So hyperventilation is the act of breathing too fast, causing too much CO2 or carbon dioxide to be removed. Triggers include certain meds, central nervous system abnormalities, high altitudes, heat, exercise, panic, fear. There are any number of things can cause one to hyperventilate. On the other hand, we have hypoventilation, where we have a low respiratory rate or shallow breathing. This can lead to hypoxemia or a low level of oxygen in the blood. But unlike hyperventilation, where there's too much CO2, and hypoventilation, we don't have enough CO2, so there's a fine balance. So we will hyperventilate to retain CO2. We will hypoventilate. I'm sorry, I said that backwards. We will hyperventilate to get rid of it, and we will hypoventilate to keep it. Hypoxia is an oxygen deficiency in the air. Hypoxemia is insufficient oxygenation in the blood. Lung elasticity is the ability of the fibers of the lung to bounce back into their normal shape after breathing in and out. Okay, so that's really important when you're discussing emphysema or portions of COPD. With this disease process, overstretching of these fibers have occurred, and it diminishes their ability to recoil over time, so their lungs and their alveoli remain somewhat inflated and are not very easily to deflate. They often look very barrel-chested in nature. Lung compliance is the ease that our lungs inflate and deflate. Certain diseases can make the tissue less pliable, so therefore they don't expand and contract as easily. Edema in the lungs, swelling in the lungs can cause this. The loss of surfactant, everything sticks together. And conditions like COPD that cause the fibers to be replaced with scar tissue and whatnot. Airway resistance, that's usually caused by narrowing of the passageways. It makes it difficult to breathe. The best example of that is asthma or severe anaphylaxis reaction, where the tiny airways constrict and the person can't move air. Okay. As you learned probably in health assessment, you can count a respiratory rate by placing your hand on the chest and count that way. Just keep in mind when you do that, the client knows what you're doing and they can manipulate their respiratory rate. So this diagram depicts what swelling or edema of the airway will do. Up top, you have a newborn airway that's roughly 4 millimeters in diameter. Below that, you have an adult that's roughly 20 millimeters in diameter. And then you have on the other side what happens with swelling or edema of the airway. So in that newborn, you see that it decreases down to 1 millimeter of swelling, reduces the actual airway down to 2 millimeters, and in an adult, it decreases it down to 18 millimeters. The point here that you need to understand is although both airways are narrow and constrictive, the adult has a better ability to compensate with that than the newborn. So a narrowed airway in a newborn can be a deadly situation. We've all heard of surfactant. It's a lipoprotein that has adequate levels, reduce the surface tension in the lungs. The thing about this is if we use prolonged long-term high concentrations of oxygen on our patient, it reduces surfactant production, and that causes our alveoli to collapse, and then we lose lung elasticity. We also can have collapsed lungs from these. An example here is a prolonged ventilator use. Now, this is something you'll see later on as you move through the program. You're not going to see this right out of the bat, but you might be taking care of someone who's had this issue after they've been ventilated for a long period of time. So the picture to your left shows the CO2, O2 moving back and forth and stuff that you already know. And then this picture to your right is a young man. Looks like he is a trauma patient. I say that because he is in a cervical collar, that big green thing around his neck. Just down on his left shoulder, you see that little bulb-looking thing that's compressed. It's got blood in it. That's called a Jackson Pratt. He also has a feeding tube going through his nose. You also see several IVs, central lines, one in his right cavity or right chest there in his gown. It looks like on the top of his head he has a dressing. So he either has a dressing that's covering a wound, but if you look at his left eye, just above where that is on the bed, you see some kind of cable that looks like it's going to his head. So it looks like he might have an intracranial pressure monitor in place as well. And that would probably be the case because his eyes look awfully swollen and black and blue. So this young man, because he's going to be on this ventilator for a while, is at risk for losing his surfactant. So our goal is to provide optimal oxygenation, and we can do that in multiple ways. And we'll talk a little bit more about that later on when we look into the delivery systems for oxygen. So we can do that as simple as a nasal cannula, which most of you have seen, all the way to a ventilator like you just saw in the previous slide. But keep in mind, anytime we put a person on a ventilator, we also increase their risk for ineffective airway clearance because we have to occlude their airway with a tube. It causes all kinds of issues. We also help people maintain oxygenation through chest tube drainage systems. If the lung has collapsed, we need to re-expand it, and that's what that little bag in the bottom is showing you. Sorry about the email interruption there. Um, and certain types of medications either impair or assist our respiratory effort. So medications are a big issue here for us as well. So some factors that impact oxygenation, just like anything else, factors range from our age and developmental status to environment and whatnot. So from a developmental stage, our very young, less than 32 to 34 weeks gestation, there's a lack of surfactant production. So the lungs might be underdeveloped. Their cardiac output is less when we're very young. And then adolescents, as we all know and remember, participate oftentimes in risky behaviors, smoking, choose your smoke, be it cigarettes, marijuana, others, and they inhale toxins. The two photographs here in the picture depict vaping. When this first hit the market, we thought that it was going to be a safer alternative to cigarettes, but depending on what study you read, it is not. Some studies say it's as dangerous. Some studies say it's more dangerous. And the bigger issue right now is none of this is governed by the FDA, so you really don't know what you're getting in the flavored vapes. I'm not going to get on my little soapbox about these, but you're still inhaling toxins when you participate with this. So factors for our older people have a reduced chest wall movement because they've lost that elasticity. It doesn't recoil and expand the way it used to. The alveoli also use their ability to expand and contract. They may stick together because of lack of surfactant. Because of this, these people have a little bit hard time expelling mucus and foreign material. So their cough is not effective, their reflex is not effective, their mucous membranes may be drier, and they also may lose cilia as time goes away. And if you remember, cilia are those tiny little hairs that are along our airway, especially in our nose, that help filter. Okay, so because they don't have that cough reflex the way they used to, they're prone to aspirating fluid into their lungs as well. Okay. Um, Decreased cardiac output, declining immune system are issues here. So our gastroesophageal reflux disease or GERD or hiatal hernia. Any number of issues make it a little more difficult for the individual to breathe. And as we get older, our chemoreceptors respond a little slower, resulting in a risk for hypoxemia. Other factors that we impact oxygenation we know about: stress, allergic reactions, air quality, altitude, all impact our oxygenation status. Stress, it triggers the release of catecholamines, which increase the tendency to blood clot. So therefore, a lot of stress, rare situation, puts you at prone for an emboli or pulmonary emboli. Stress also suppresses the immune and inflammatory system, resulting in an increased risk for infections, including your upper respiratory infections, flus, colds, those kinds of things. We've all heard and seen of allergic reactions, whether it's to peanuts or dust mites or dogs or cats or whatever. That impacts your oxygenation level because you have the inflammatory response. With the allergies and hay fevers and asthma, the airways swell because of the inflammatory process and therefore narrow. Air quality, depending on where you live, what your air quality is like, it is better than it used to be, but it's still not 100%. And take in mind that may not necessarily mean pollution. If you are taking care of someone who is a painter or paints automobiles or works in a cotton mill or works with chemicals, or even someone who's a carpenter who is around wood dust, it impacts their air quality. Altitude, oxygen levels are lower in higher altitudes, so it takes a little time to adapt as we move up in altitudes. Any of you have ever flown? If you notice, flying sometimes when you're not feeling well, it's a little harder to breathe until you get up there and you get used to it. Temperatures and humidity. There's nothing like going out in the wintertime when it's -5 and the air hits you. It's really cold, sort of takes your breath away. But then again, in the summertime when it's 95 degrees and the humidity is 100%, you feel like you're breathing in a shower. So temperature and humidity impact our oxygenation status as well. Some other lifestyle issues impact our oxygenation factors. Pregnancy, it increases metabolic rate during the second half, so they tend to breathe a little faster because they're trying to oxygenate not only themselves but the baby. I talked a little bit about oxygenation or occupation hazards. Nutrition, people who don't have the right nutrition lose their muscle strength in their thoracic cavity, so they need some protein to help build that up. Individuals who are technically obese with a BMI over 30 are prone to respiratory infections because of hypoventilation and dyspnea on exertion. That's dyspnea or shortness of breath when they move around. They often have difficulty with sleep apnea, mainly snore, and they may have periods of apnea lasting 10 seconds to a minute and a half. I'm not even going to talk about smoking. We know what smoking does to our body. I don't need to tell you that. What we do need to understand is when you stop smoking, the body starts to repair itself. It does take time. It's not something that happens right away, but it does take time. So it's really, really important that we teach and talk smoking cessation to our patients. And smoking includes any kind of smoke or toxin inhalation, be it cigarette, cigar, pipe, marijuana, whatever, including our vaping. We need to at least decrease that, if not stop it altogether.